So I love dentistry because not only am I getting the chance to change a smile, but it gives us the opportunity to change a patient's face. It allows us to change their life. They want to get back chewing. They don't want to hide behind their hand. They want to be able to eat what they want with their friends, family, neighbors, and go out and live.
My teeth, all my life, every time I went to the dentist, I would have 16 cavities. I had crowns, I had root canals, I had had a lot of dental work, and my mouth was always painful. And once we contacted Dr. Valenzuela's office, it was seamless. It was perfect. And when we walked through the door, we thought, this is good. He's very professional. He had his training in the United States. Some of my favorite things about picking this practice is when we initially walked through the door, the staff was very friendly. They're accessible. You can call them. All the professionalism and the equipment that you would expect. I think as far as quality dental work, I have been to many dentists in my life, and this just rates right up there. They're very attentive and they describe things. They made it painless, really.
After thousands of hours of continuing education with a focus on restorative and dental implant treatment, and after placing tens of thousands of dental implants, we're able to handle the most complex scenarios. We do everything from digital X-rays, CT scan. We do a 3D view of the patient's skull, and then later on scan the face. So it becomes a lot more predictable knowing where the implant goes, because you've incorporated various layers such as the patient's bone or anatomy, the face, the smile, the lips, the teeth, all of that comes into play. So there's no second guessing. And this is mind-blowing because a couple of years back, let's say 10 years back, this was not available. So there was a lot more guesswork involved. As far as technology goes, how our practice would stack up is at the same level as an American practice. One of the things that makes patients feel more at ease is knowing that I am a part of some American organizations such as ADA, ICOI, AACD, and AAID. And I've always believed that great quality dentistry does not have to break the bank. So the first step for dental implants is to get a consultation where we'll meet each other. I get to listen to your needs, your goals, where we want to be headed with this, to see if you're a good candidate for dental implants. During the consultation process, we'll be able to determine the complexity of your case. Once we determine the complexity of your case, we will decide if it will have to be guided or non-guided. Whichever the case, we can get started the same day. After a few months, once the implant has integrated nicely into your bone, the next step will be to take an impression. In the upcoming appointment, your crown will now be placed, and that's how we end the implant process.
I had a crown that a couple years back removed itself. It was discomforting to the tongue. So I wanted to have the tooth removed and an implant installed. They gave us an approximate price over the phone. The staff so far has been wonderful to work with. They're very upfront. Doctor said with the bone loss, we need to take the tooth out and put an implant in. That is our recommendation. So they did the first day, removed the rest of the tooth painlessly. I was very surprised and happy with how well it went. It was fantastic. I come back in between 4 and 6 months after it's completely healed. I'm in the process now where after it heals, I come back and have the implant installed.
For full arch solutions, the process is a little bit different. It takes a total of 3 trips. During the first trip, our goal is to place implants and have you leave with nice looking temporary teeth. After a few months, once the implants have integrated nicely onto your bone, the goal of this second trip is to fine-tune the design of your new smile. During this trip, we'll take a new set of impressions and make new temporaries for you based on your feedback. And on your last trip, in as little as a week, we can deliver your finals and you can show off your NewSmile. When it comes to pricing for dental implants, a single tooth implant might cost you around $3,500 in the US. Here in Mexico, it's around $1,500 per tooth. So if you're getting multiple implants or a few implants, you're literally saving thousands of dollars. And for all-on-fours, full mouth rehabilitations, and larger cases, something that can cost $50,000 or more, we can perform for around $25,000 without sacrificing quality.
I have a dentist that I do taxes for, and he said, well, it's going to be $52,000. Well, this was 25. And we got titanium and we got bells and whistles, and we come down here once, twice a year, and they check her teeth and make sure everything's fine.
Most of our patients fly into Phoenix, Arizona, or San Diego, California. Then they drive into Yuma and stay in Yuma, Arizona. They leave their car parked on the US side of the border and walk across, and that is where our shuttle can pick them up.
You're going to Mexico. You might have concerns about safety. I've been to Mexico several times, but crossing the border is very safe. Go through check stations, very, very casual. I didn't feel any concern for mine or my wife's safety.
I believe that you're getting the same quality of care here that you would in the United States. If you were considering coming down to Mexico to have your dental work done, it's very common. And I think that Dr. Valenzuela and his staff, most people just call him Dr. Jose because by the time you meet him, he's so friendly. And I think that you would be really impressed. It was one of the best decisions I made to have a pain-free mouth. Of course, you end up with a beautiful smile, and it's funny when people would say, oh, your teeth are beautiful. At first I would say, oh yeah, they're all implants. And then I kind of quit saying that and just said, thank you. It's a great experience, it really is.